Mayor Eric Adams facing some pushback after his mental health announcement last week. The city will now involuntarily hospitalize more people with severe mental health disorders. The mayor said it's all in an effort to make sure that people get the help they need. Emergency responders directed now to intervene in more cases on the streets and in the subways. Listen.
And we want to be clear, not wearing shoes, shadow boxing, talking to oneself. That is not the criteria. You know, we need behavior, and you cannot take care of your basic needs. We want to be very clear on that.
Historically, we know that these types of forceful interventions, including involuntary interventions on the subway, will lead to arrests and then taken into the criminal legal system that has no solutions except for jail and prison.
So the Legal Aid Society and the New York Civil Liberties Union both raised concerns about the city's new policy, as did police officers who are concerned with how to implement this very policy. So I want to bring in PIX Panel's Ayana and New York Post reporter Craig McCarthy, who have both been covering this story closely. Thank you both for being here. Good to see you on the PIX panel. And I want to begin with you, Ayana, because you were there for the announcement, right? Was it clear from the start that this would actually get some pushback? Did the mayor know that?
Absolutely. The mayor gave us an opportunity to ask questions, members of the press. We pressed the mayor on this issue for about an hour. And at the end, many of us reporters still had several questions. Look, the mayor is seeking to tackle an issue that is difficult, that is very sensitive. How will the city care for people who have serious mental health disorders, who are also homeless? He's not the first mayor to try and tackle this. And I think at this point, there is still a major legal question. Now, this mayor says the city lawyers have taken a look at state law, and they believe they have the right to take people to the hospital without the will if they're unable to meet their own personal needs and have some mental health disorders. But the New York Civil Liberties Union, they've certainly raised some questions on whether or not this is legal. And of course, that's also going to depend on how this is all implemented. Right, and implementation regarding some training as well for everybody who will be involved in that. You just heard from the MTA chairman, Jano Lieber, about some of the training. But Craig, I want to share some of your exclusive reporting on the NYPD's reaction to the announcement, right? The headline from your paper reading, police were, quote, blindsided by the move, and that there was a scramble last Wednesday to start making it happen. However, we had NYPD Chief Madry on the PIX More News, Craig. He disputed the claim, right? So tell us more about your story and why you actually stand by it.
Also, we spoke to multiple high-ranking sources in the NYPD, and they explained to us that when this announcement came down, they believed that they jumped the gun. They didn't have any policies in place. There was no patrol guide orders to carry this out, and they were scrambling on Wednesday to figure out how they were going to implement this. I mean, the initial statement from the NYPD when we asked them about how they were going to roll this out, and with officers doing this, what training was going to be offered, they first said that they were first made aware of this directive when the mayor announced it, when they sent it out to all the city employees. So the question becomes is how are they going to cater a training to this if they just got the directive? But then later they said that they've been working for months on this project.
So where are we standing with the training?
Well, Dan, I do want to mention at the mayor's press conference, it was notable that there wasn't a representative there from the NYPD. The police commissioner wasn't there. We asked the mayor about it. He said she wasn't feeling well, but there are certainly other high-ranking officials that could have stood on the steps of inside City Hall with the mayor. In terms of training, the mayor has said that it's time to train NYPD officers and other first responders on how to respond to people with severe mental health disorders with compassion and with care. But as we just heard from Craig, sort of the details, those still haven't really been explained to the public, and it seems like they really haven't been explained to first responders. Yeah, and then public advocate Jumaane Williams disagreeing with the policy as well, saying these decisions should not be made by police. So, Craig, where was the police commissioner the day of that press conference? What has she said since?
Well, it's funny because when reporters asked Mayor Adams where the police commissioner was, she joked, as you said, that she didn't feel well, but she was actually at One Police Plaza walking out the former chief of department now, Ken Corey. She was there laughing. She was joking with people from other reporters that we had on the scene. So we're not really sure what this disconnect was. I mean, it seemed like the messaging was not lockstep until about 6 p.m. after when our story was coming out on Wednesday.
And lastly, because we're almost out of time here, Ayana, are hospitals alerted to the potential arrival of more patients because we're seeing an uptick with RSV and flu and so on and so forth? COVID is coming in winter. What are they saying?
So the CEO of New York City's Health and Hospitals, that's the public hospitals in New York City, he was there at the announcement. So it seems that there was some coordination with New York City's public hospitals, but it's unclear. We haven't heard yet whether or not the city has reached out to communicate with private hospitals and if they'll even be a part of this plan, right? We still don't know.
Right.
When a police officer picks someone up who's in mental health crisis, where do they take them? Still unclear.
Understood. A lot more to discuss. Well, I'm sure we'll stay on top of it. Ayana, Craig, thank you both for being here. We'll be right back, everybody.
Thanks,